Heather Eager, and I'll be doing a presentation over lupus. There are 4 different types of lupus. The most common is the systemic lupus erythematosus. This is commonly abbreviated as SLE. There are 3 other types of lupus as well, and these are the drug-induced lupus, cutaneous lupus, and neonatal lupus. It's an autoimmune disease that results in the immune system attacking itself and producing inflammation of multiple organs. It can affect the joints, skin, brain, lungs, kidneys, and blood vessels. It's also considered a rheumatic disease, and it's known to affect joints in the same manner that rheumatoid arthritis does. An interesting fact about this condition is that the word lupus in Latin means wolf, and was applied to these patients as a descriptor by Regarius in the 13th century to describe his patients whose facial lesions bore a strong resemblance to a wolf's bite, which is shown here to the right. Pictured here are the different types of lupus that I discussed previously. Systemic lupus is the most common form. It's what people are generally referring to whenever they discuss lupus. It can be considered mild or severe, and it can affect any of the body's organs or their systems. For cutaneous lupus, it's limited to the skin and can cause many types of rashes and lesions. These rashes are raised and may become scaly and thick, which could result in scarring. The drug-induced lupus presents itself like this condition, but it's caused by certain prescription drugs. And then neonatal lupus is not a true form. It's a rare condition that affects infants of women who have lupus, and is caused by antibodies from the mother acting upon the infant in the womb. The etiology of lupus is unknown. There are thought to be environmental, genetic, and hormonal factors that come into play, but nothing conclusive has been found. 9 of every 10 occurrences of lupus are in females, so researchers have started to look at the relationship between estrogen and lupus. They've also identified more than 50 genes which they associate with lupus. These genes are more commonly seen in people with lupus than those without the disease, and while most of these genes have not been shown to directly cause lupus, they are believed to contribute to it. Some environmental elements that could trigger lupus are ultraviolet light, infections, and exposure to silica dust, which occurs in agricultural or industrial settings. Lupus is the result of an abnormal immune response. The 2 main cells involved are the B lymphocytes and T lymphocytes. So this abnormal immune response occurs because of that genetic factor or environmental factor that we discussed, and then hormones could also be a contributing factor to this. When the B lymphocytes become overactive, they lead to an increase in autoantibody production, and then when this increases, the T lymphocytes also increase in reactivity. So that's that immune response, abnormal immune response that occurs. And whenever this happens, an inflammation occurs, and this could happen in any organ system in the body. So what happens is the cells that are responsible for fighting off the foreign antibodies, they begin destroying the body's own tissues, cells, and serum proteins. And whenever this happens, then damage starts to occur within these organ systems that are affected. And this could be anything from the digestive system to the kidneys to the heart. Anything could be affected with this particular disease. Once the complexes form and that inflammatory response is triggered, then the tissue destruction occurs. The inflammatory response caused by the B and T cells are the reason for the signs and symptoms of lupus. It can affect any organ system, and the symptoms can vary from person to person because of this. The most common symptoms are fatigue, skin rashes, fevers, and pain or swelling. Specifically in cutaneous lupus is that butterfly rash that was pictured earlier in this presentation, and that occurs in 26% of people diagnosed with that particular form of lupus. But skin involvement in general occurs in 80% of patients that have this condition. Some other symptoms are sun sensitivity, oral ulcers, arthritis, lung problems, heart problems, kidney problems, seizures, psychosis, and blood cell and immunological abnormalities. This disease is similar to multiple sclerosis in that it has flares, and these are described as periods of active symptoms. These flares are present for an unknown amount of time and vary between person to person, and then you can enter a period of remission where the symptoms are lessened or they're no longer present. Lupus is known by physicians because the symptoms that it produces replicate other diseases, which is what makes it so difficult to diagnose. So I put just 3 up here. For example, I mentioned this earlier with multiple sclerosis, they share a lot of the same symptoms. So lupus actually can be misdiagnosed for this disease. Same with Lyme disease, rheumatoid arthritis, they present with a lot of the same symptoms. So this causes frustration in clients who are trying to get a definitive diagnosis and figure out what's going on, and physicians pretty much have to rule everything else out in order to be able to diagnose it, since it presents as so many other types of diseases. Anyone could be diagnosed with lupus, however, women are 6 times more likely to be affected than men, and this affects childbearing ages the most, so ages 15 to 44. 9 out of 10 people with lupus are actually women. I provided a little chart there for you guys as well to the right that shows men and women, and then Caucasian versus African American. Those in the minority racial and ethnic groups tend to be affected more than Caucasians do. And I also found that Northern Ireland has the highest prevalence of systemic lupus, while people of the Black Caribbean have the highest incidence and prevalence. As I mentioned previously, lupus is difficult to diagnose since it imitates other disorders. The symptoms can also change over time or enter remission. So a client could come in and test positive with some diagnostic tests and then come back, be in remission, and test negative. So it's difficult to get that definitive diagnosis of lupus. The most common laboratory test utilized to assist in diagnosing lupus is the anti-nuclear antibodies test, or ANA. The ANA test is positive in 95% of people who have SLE, and although its specificity for lupus is only 20%, and a positive ANA result can appear in other autoimmune disorders as well, which is another reason why it's difficult to diagnose. The treating physician will initially examine the patient and evaluate any symptoms that are present. Inflammation is the most common symptom, and it could be present either inside or outside the body. They'll also look at any diagnostic tests that they could use. As mentioned, the ANA test is a common one for lupus, so if that's suspected, that's one of the go-tos. The medical history of the patient and their family will be evaluated. And then another commonality that's found in patients with lupus is the presence of those autoantibodies. And these are against a double-stranded DNA or other extractable nuclear antigens. Here we have a message from Dr. Stohan regarding the treatment of lupus.
Treatment is always remission all patients need to be on an anti-malarial drug. They are the mainstay of treatment, and these are hydroxychloroquine or chloroquine. They decrease the chance of flares by 50%. They help patients live longer. They protect their brain and their kidney from lupus. They help the skin and the joints. And unless somebody has difficulty tolerating them, we put everybody on them. The risk of using them is a risk of retinopathy. Sometimes they can deposit in the back of the eye. And for this, patients need regular screening. Now, in the olden days, NSAIDs like ibuprofen and naproxen were used for some manifestations of lupus like pericarditis or swollen joints. Nowadays, we generally tend to avoid them because they are associated with a higher cardiovascular risk. Patients with lupus have a baseline elevated cardiovascular risk, so we try to avoid adding to that risk. Corticosteroids, we also try to avoid in the long run. Lupus patients are very sensitive to steroid side effects, and there's data that the incidence of these adverse effects with glucocorticoids is more common than in other autoimmune diseases for unknown reasons. So patients with lupus will gain weight, they can have high blood pressure, high cholesterol, glaucoma, cataracts, gastritis or bleeding from the bowels, osteonecrosis, which is like a heart attack of the bone where the blood vessels constrict and don't get blood to the bone anymore. There's an entire range of metabolic complications that occur with it, so we try to avoid them unless absolutely necessary. Cardiovascular risk is high in lupus. It's, again, a common misconception that the main problem in the long run is lupus itself. It's not. We're pretty good at treating lupus flares. We're pretty good at treating infections that may span from the disease itself or from the treatment. But after 10 or 20 years, the main problem that patients face is a cardiovascular risk that's highly elevated. So addressing the cardiovascular risk factors is an extremely important thing. The cardiovascular risk is equivalent to someone who has diabetes. So exercising, avoiding weight gain, eating healthy, making sure your blood pressure is under control, making sure your cholesterol is under control. These are very important things that patients need to work on.
The prognosis for lupus is generally good. 80 to 90% of people diagnosed have a normal lifespan. Secondary conditions such as cardiovascular issues actually have more potential to be life-threatening than the actual condition itself. Physicians encourage patients to be active and lead a healthy lifestyle in order to combat any secondary symptoms that could occur. And they should follow the physician's orders regarding any medications because this can lead to the best possible prognosis. If treatment and consistent evaluations do not occur, the condition could begin affecting life-threatening organs and they wouldn't be aware of it. So this could potentially cause the prognosis to decline. About 50% of patients diagnosed with lupus do not have life-threatening organs involved, but since lupus is characterized by those flare-ups that vary in severity, this could change at any time, which is why seeing your physician regularly and going to your checkups and following their orders is very important for this diagnosis. I wanted to touch briefly on the impact that lupus could have on occupational performance. It's considered a rheumatic disease, so it presents with similar deficits that are found in diseases such as RA and fibromyalgia. These could be fatigue, difficulty with fine motor ADLs, pain, and lifestyle changes. It's important to teach our clients energy conservation techniques, educating them on how to balance rest with activity participation, joint protection, educating them how to protect their joints and utilize adaptive equipment, and taking into consideration the psychosocial factors that could occur because lupus is a difficult condition to diagnose, so they often wait years for a formal diagnosis. And that's it. Thank you guys for listening to my presentation, and I look forward to answering any questions that you guys may have.